Hi everyone, this is the project presentation for Team L. Our project choice was social networking in healthcare. So a little bit about our project background. We had to design a user interface for storing imaging scans such as MRI, CTs, and X-rays for a hospital system. This application would be used to archive the images and reports for the radiology department, as well as be used as a scheduling software which can be accessed by hospital staff and patients alike. This application allows for doctors such as radiologists, emergency care physicians, and internal medicine physicians, as well as nurses, radiology technicians, receptionists, and patients to access information regarding their imaging. Each user is going to have a different view, functions, and access. So we're going to jump right into our prototypes. Here we have the prototype for the login UI. The login page was supposed to be simplistic. As you can see, we have a username and password, a remember me checkbox, and a login. This page is security oriented and HIPAA compliant. When dealing with healthcare, we have to be vigilant about patient privacy and making sure that we remain HIPAA compliant. The next slide here is the imaging UI. So this is the main interface that a user is going to view when they want to see the imaging results. This allows users to go through different images taken and look at the radiologist's notes. There is the option to generate a detailed report from the radiologist on this page. And the next slide, we have the first patient UI. The patient UI is very modular. We tried to make it clean and give the patient their options up front that they could select from. As you can see, they have the option to access their records, their forms, fax. They have the option to ask a nurse a question, request a refill for a medication, request an appointment, see their test results, view a HIPAA disclosure, or access their account. At the top, they can also see scheduled appointments, see services, and contact their doctors. On the second page here, we have another view of the patient UI as if they had switched to the Contact Your Doctors tab. And as you can see on this tab, they'll actually be able to see their doctor's names and phone numbers that they can get a hold of them at. So then we have the receptionist UI. The receptionist at the hospital is going to help coordinate patient appointments. Trying to remain HIPAA compliant, a receptionist would not have access to doctor's notes, patient medications, and information like that. So we try to keep this pretty simplistic and keep any sensitive information off of it. As you can see, they'll be able to see the patient name, patient ID, possibly what room number they're in, and the doctor's name. And they'll be able to see the patient's scheduled appointment, as well as make further notes and schedule patients for new appointments. Then we have the nurse's UI. So the nurse is going to be able to see more information. On this page, you can see that they can actually see patient and nurse notes. They can see the medications that the patient is on. They can see all the radiologist's reports and notes, and they can actually see an image of the patient's scan.
This is the user interface for the doctors. There's a display for recent patients who have had scans, a calendar for appointments, and a need-to-do list, such as following up with a patient who has had a scan done. This is the user interface for the radiologist. They have a list of patients that have recently had scans done, so that the radiologist can make sure that their reports are complete for each patient. This is the user interface for the radiology technicians. Similar to the user interface for the doctors, here there's also a display for patients having scans done that day, a calendar for appointments, and a need-to-do list, such as uploading images to the system. Now, some of the feedback that we received was a question about why was there only a single login page for multiple users that each have different user interfaces. Another bit of feedback was, how can the user actually register in the system? Someone else asked, what does the radiologist button in the imaging user interface do? Someone requested that we show all pages for every tab. It was how does the patient get removed from the daily schedule? And also, how are scans added to the system? Someone also requested that we please upload pencil prototypes for better feedback. And lastly, it was suggested that the boxes on the right side of the user interface are too small to actually show any useful notes. Now, some of the ways that we could improve based on this feedback are, 1, since there are different users but one login page, maybe we could add a place on the login page to allow the user to select their respective department or affiliation. 2, each user would be emailed their credentials for the system. So if you're a patient or physician with privileges at the hospital, then you will be emailed your username and password, and then the user's password could be changed after confirming their credentials in this manner. 3, the radiologist button is used to generate a detailed report of the scans, so in the next prototype, we will design a user interface for the generated report. 4, we need to add a user interface for all possible tabs. And 5, the receptionist is responsible for checking in patients and checking them out. And once they are checked in, their status is updated. And when they are checked out, they are removed from the daily schedule. 6, the radiology tech is responsible for uploading the images to the system so that the radiologist can evaluate and write a report for each scan. And 7, next time we will submit the actual pencil files for the prototype to receive additional feedback. Our group decided to design different user interfaces specifically for each user. We felt that it was important for each user to have their own interface because each user will have different levels of access to the information and will each have different tasks. For example, a receptionist at the hospital does not need to have access to patients' records. For another example, patients would need the ability to view their medical information but should not be able to make notes on their own chart. We created multiple user interfaces for the prototype, but only one prototype for the entire application. This is our first iteration, so we do not yet have experience with refining the prototype based on feedback. Our group followed the user-centered design process model, planned out our meetings and deadlines, created all of the personas for possible users, defined all technical and non-technical requirements, created prototypes based on personas and requirements, and posted our work online for feedback. Other techniques our group used to help aid in the design process were brainstorming and usability inspection. Specifically, in this case, it was the pluralistic walkthrough. We feel that it is always important to brainstorm both as a group and individually to try and figure out design requirements for our prototype, and this was very helpful when completing the pluralistic walkthrough. Our group walked through every possible user we could think of and thought how we would want to utilize the application, but we also kept in mind how the hospital overall would want the users to utilize the application. We feel that the walkthrough is very helpful with designing the unique interfaces for each user. When we appraise our project management thus far, we feel that we are not ahead nor behind of schedule, but exactly where we need to be for this iteration. That being said, everything feels a little bit rushed because of the short semester. Also, with an application of this size, there's the possibility for many risks. We feel that some of the risks we face in this project are 1. Security. When working in healthcare, security is vital. 2. Usability. Since there are many users, it is important to get each of their needs met, but at the same time make sure the hospital is satisfied. And 3. Schedule. Even if we are on time right now, we still have a long way to go, and time is always a concern. Since we are able to get feedback for this iteration, we feel that we will be much better off for the next iteration.